I will defer to Senator Braun.
Thank you. When I look at what we do here on this committee, I think whatever the particular topic is, we need to weave it always into maybe a little broader discussion. When you look at COVID coming along, catching our country by surprise the way it did, I think a big part of the trickiness of navigating through it was what is true and what isn't. How much transparency is there? I know in my own business that I ran that I could only look back on in terms of what they were doing. We took it seriously, just like we took healthcare seriously 15 years ago when I was sick and tired of a healthcare system that was telling us how lucky we were that our premiums are only going up 5 to 10% a year, along with zero transparency into the system. I think COVID, if you want to find a silver lining to it, shows you how when you really get into a predicament where it's just laced with uncertainty, novelty, and then you try to remediate it through a system that you know is not real good at taking care of the standard operating stuff. No one should go broke in this country because they get sick or have a bad accident. I think most of us, thank you, and that should be something we all agree with. Then it gets down to what are you going to do about it? So I want to highlight something that the chair of the committee and I are doing, and then the question will be around that as you navigated through your own complications with COVID. To me, when I wrestled with it 15 years ago, there was zero transparency. You basically hoped that your insurance plan was going to take care of it. You never found out the net result until 3-4 months later when you opened the envelope up with trepidation to see how much it was going to cost you. That's no good. We've got a bill called Healthcare Transparency, Competition, all the things I've been talking about. So there are bigger things working here in the U.S. Senate. And thank you, Chairman, for doing that alongside many of us that are interested in it. Let's start on the left side of the down here. Tell me, once you got into your own predicament fighting COVID, was it easy dealing with the system itself when you were trying to see what your alternatives were? Could you actually quantify that into how much it was going to cost? And tell me what that was about.
The costs of living with long COVID are high. I have an excellent employer-based health plan, a PPO, and I still last year spent $4,000 out of pocket on medically necessary care. This was not alternative care or they were things that were not covered, that were denied by my health plan. And that was for a variety of reasons. A lot of my medication needs to be compounded because I'm allergic. Insurance does not cover compound medication easily. I spent hours, probably a total of 40 hours over a month, just trying to get one medication covered. So that there's a cost, there's a financial cost and a time cost.
Thank you. Ms. Beal.
Yes, for me, the same thing with the cost. So I have, my copays that I pay for every specialist I see, and that really adds up. Also, I live in a small town about an hour away from most of my doctors, so I'm having to drive everywhere to these appointments when my time would be better spent resting instead of going everywhere to try to see the doctors. It's very frustrating for me. With my medical insurance, I have to see my PCP to ask for a referral. So when I wanted to see a neurologist, I had to ask to go see a neurologist or cardiologist, hematology. Every time I had to have a referral. And then you have to wait 6 months to get seen by the specialist, and all this time is going by, and you know what the issue is, but you can't get in front of the right doctor. So that's been very frustrating. Insurance, when things aren't covered that you need, it's very demoralizing because you need it and it's out of your, not in your own personal budget to cover it. one of the things that I need is massage therapy for my chronic pain. And I pay out of pocket, but I can't afford to go every week like I need to. I go maybe once a month. And, that's something that helps people with long COVID. So why can't the insurance cover it?
Good question.
Really
Ms.
frustrating.
Heim.
My experience is very different because my daughter's on Medicaid. So what was going on with us was, well, first off, in order to get into Children's National, there was a lot of prior authorizations that needed to happen. I definitely feel for my doctor's office sometimes because of the hours that they put into getting us into some of these specialists. But part of the reason why we moved states was because we previously lived in West Virginia, and whenever I needed to see a specialist, which was a lot, we had to drive over 3 hours to go to the university to see a specialist. So it was like a full-time job getting her to all the appointments and the testing and all that stuff. So that was very
Well, I
hard.
think you're all saying the same thing. We've got a kind of broken system that lacks transparency, competition, and all of that. Again, this healthcare price transparency 2.0 addresses all of that. And until we get that, we're always going to be wrestling with issues like you've just described. Thank you.
Thank you, Senator Braun. Let me take Chairman's privilege to